The ACIP committee, which is the Advisory Committee on Immunization Practices, recently met. This is a very well-respected group of medical and public health experts that kind of review the data available and then help medical providers make the best decisions with regards to vaccination for their patients. And so the committee met and decided that based on the review of the data, and that by a 15-0 vote that we should move forward and add the COVID-19 vaccination to our regular pediatric vaccine schedule for 2023. It's been a little controversial, I would say, because I think there's a lot of misinformation about what this actually means. So what this means is that when the federal government stops purchasing vaccinations, that kids without health insurance will still be able to get their COVID-19 vaccine for free. It does not mean that the CDC is mandating vaccines for schools. These mandates actually are done at the state and the local level for which vaccines are mandated in schools. So the vote was resoundingly supportive of getting our children protected against COVID-19 to the best of our abilities. And fortunately, vaccination is one of those tools that we can and that we should use. So the vaccine is safe and effective. Burden of COVID-19 in children has proven to be substantial. And we know that these that people, as Dr. Bratzler just informed us all, people who are vaccinated are much less likely to contract COVID-19, much less likely to be hospitalized secondary to COVID-19. And it is a strongly recommended vaccine to prevent disease as well as prevent post-COVID-19 sequelae. So I would recommend that families very strongly consider making sure that their children are up to date on their vaccinations, not just their COVID vaccinations, but all other vaccinations. I will add that because of the misinformation surrounding our COVID-19 vaccinations, that our other previously universally accepted vaccine campaigns have come under attack, and some families are not wanting to get their regular measles vaccine or tetanus diphtheria vaccine, or even the influenza vaccination. This is very concerning.